All right, good morning. It's Monday again. Wow, how time flies, one week to the next. Hope everyone's having a great time. I know it's a little challenging out there. I can't help but kind of respond to the things I'm hearing on the TV when it comes to, new therapies for COVID, the new testing. And I'm not sure how much you guys are following it, but some of the information comes in so fast, it's hard to keep track, what to pick on, what to talk about. But, particularly what's exciting is that Yale University have come out with a Covert test that you can collect from saliva. So that's exciting. It's particularly useful because you don't need a practitioner of any kind, like a nurse or a medical assistant, to actually do a swab or collect any sample. So that's the benefit of that. And, I know so I'm going to wait a few more days to kind of hear how the medical world respond to it. But I'm going to give you a clue about what I want to talk about. When you hear about a new product, I know it's easy to knock down, where's the evidence? Well, by definition, anything new, it's hard to get the evidence. That said, there's a lot of animal studies, there's a lot of other information, and the point I'm going to elaborate on is, when there's something new, that's fine. Don't call it treatment, because that's when you rile up the medical world, because then they say, where's the studies, where's the evidence? And I think that if you just step away from that word treatment and go to may help support the body, then we can have a really good discussion about proactive things that people can do. Because at the end of the day, when you're throwing things back and like throwing mud at people, medical profession throwing mud at somebody else, and the alternative world throwing mud at the medical, guess who loses out in the middle? The people in the middle. And it's a little bit like countries going to war, is that people don't want to go to war. Countries go to war for economic reasons, for more selfish reasons than anything, and if nothing else, power. And the poor people are stuck in the middle because most people don't go to war. It's the military or whatever, but they're collateral damage. So in a different way, but very much parallel, because they talk about the military economic complex. Well, there's a medical economic complex, and we must be aware of the good and bad in both these situations, even though they're not directly applicable. They're not directly applicable, but what's common about both of those situations is man and humanity, and their behavior is consistent along the way. So that's what I will talk about later on, but I just want to throw out the fact that if we can do saliva testing for COVID, it came out at Yale University, apparently the NBA players were the ones that were first tried it out. So I have a great hope that that's going to be quite effective. And the benefit of that, if everybody could test themselves at home, no matter how, let's say it's not very sensitive, or there's a lot of false negatives. That means that you have the disease, but it's negative. But if you repeat the test multiple times, the chances are that you're going to get less false negatives, and it will turn up. And when it's inexpensive, done at your own home with some basic common sense applications, and again, we will discuss these things once I get more information, then it's golden, because you don't want to have those people who you suspect of having COVID coming out necessarily. And certainly you don't want the doctors treating everybody in the car park, not in the winter at least, and it's complicated by other things. And then in combination with things out there where people say it may be useful, I think that if we just stick to the part that, certain things can be supportive of the body and help the body, then the medical world doesn't need to get all antsy and say, well, there's no evidence that this is the treatment. Just stay away from the word treatment, because as you've heard from me, even in my practice of medicine, that only doctors are allowed to diagnose and treat, nobody else, even though other people may be better at diagnosing, better at treating in some cases. But as far as the medical system is that only physicians, with the exception of maybe nursing and one or other two very, very certain certifications, are allowed to diagnose and treat. That's why it's a loaded word. Treatment usually comes at the end of a prescription. It's a very loaded term. It's kind of what the system is used to right now. So the point is that let them keep their word. We just focus on results, right? We focus on the best information to help us make a decision about ourselves. We get the information that helps us best take care of ourselves and get results. That's all that matters, really. That's all that should matter for medical people. But again, they're chasing their tail too busy looking at articles and studies and missing sometimes the bigger picture of getting results, not what the study shows. It's more like what the study didn't show, okay? And so that will be for later on. So today, if people don't have any direct questions on whether it's the COVID or the immune system, and I recognize a few people here. Before I continue, thank you very much for joining. Hopefully you'll learn something today. I'm going to talk a little bit about nitric oxide, but not just for blood pressure. I'm going to show you how that's such an important molecule in the body in relation to every function in the body, not just blood pressure and blood vessel health. And so I want to thank everybody for joining. And what I'm going to be discussing is about for information and education. I'm not, again, here to diagnose and treat, but hopefully the information will help you make better decisions with your family members or your doctors, and you should practice the best quality medical care using numbers wherever possible. So nitric oxide is a double-edged sword, really. I say that, in general, I have people commenting on, and it's okay, there's nothing wrong with the comment. They said, look, bodybuilders have been using it for a long, long time. That's great. Just so use that information. Bodybuilders have known about it for a long time. In fact, bodybuilders are pretty good guinea pigs. If you want to know about the best way to lose fat, they know a lot about it. You want the best way to what proteins to eat, they're the people. If you want to know the detrimental effects, follow the bodybuilders. So they could be like the guinea pigs. So, they're putting their body through all of this, and we can learn from it, actually. So there's no disrespect to bodybuilders. But I'm not sure the question came from a bodybuilder, but he mentioned that, bodybuilders have been using nitric oxide for a long time for vasodilation. Maybe they're thinking of it for the ripped veins that come out of the bodybuilders. I don't know what that the point of that is, but I think what they mean is that the nitric oxide helps increase blood flow to the body, so it gives them better endurance and better performance, right? And that's perfectly fine. So very important. I think that that's a two-dimensional approach. So just like I criticized conventional medicine about the two-dimensional approach, and I'll give you examples of that. So when the blood pressure is high, we lower it, that's two-dimensional. When the sugar is high, we lower it, that's two-dimensional. When the cholesterol is high, we lower it, that's two-dimensional. And it's no surprise that when we lower all these risk factors, we don't get 100% result. We don't get 80%, we don't get 50%. We actually get more in terms of 25% reduction in the common things that we study, like heart disease. So that's two-dimensional. So even with natural things, you can get caught up in the two-dimensional. So if I take arginine, I'll make nitric oxide, not so fast. In the two-dimensional model, it's supposed to be possible, but I'm going to elaborate on why it doesn't always follow that way. So I often prefer citrulline because arginine, when it's converted to citrulline, releases nitric oxide, so that's great. And then, but it can go the other way too. When you take citrulline, you can be forming, you can also release nitric oxide that way. Why is nitric oxide important? Because nitric oxide is actually something that keeps the body in homeostasis. That means that the body produces the right amount of nitric oxide to not only cause the blood vessels to open up and have blood flow, but also to keep the blood vessels healthy, but also to attack infections and oxidation, and we call that form of nitric oxide. I'm going to actually tell you the three forms in a minute. So look, nitric oxide is, in simplistic terms, in two-dimensional medicine, sounds great. I give arginine, I make nitric oxide, so I should make, I take arginine, I'm going to make citrulline and release nitric oxide, great idea. I take citrulline, I'm going to make nitric oxide, great idea, no problem. The only thing you have to think about, though, is that there are a few steps in between. We call those cofactors. So the two-dimensional approach is, well, I just take this and I'll just make that. That may happen in significant percentage of the population, but you're not going to get 100% result unless you think about the other dimensions, and we call those cofactors. So some of the cofactors that are necessary for the body to release the nitric oxide is things like BH4. BH4 is tetrahydrobiopterin, BH4, it's a 4-molecule methylated molecule, tetrahydrobiopterin. And vitamin C works at giving electrons to keep that cofactor moving, and without that cofactor, it's difficult for you to circulate and produce the nitric oxide. Now, how does that happen? This is the crux. The crux is that it's all related to something called NOS. So NOS, and I'm just going to give you a little science, then I'll go over how to understand it. So the science is NOS. What does NOS stand for? NOS stands for nitric oxide synthase. So that's your body's ability to produce nitric oxide from that enzyme. But that enzyme exists in all of the endothelium, in all your blood vessels. It's there to protect you. It's there to soften the blood vessels. It's there to stop it from proliferating, getting, proliferating means in a bad way when it grows and gets stiffened up. And it also is involved with making the platelets less sticky. If some people have followed me on social media, on my Instagram, about the little videos I'm making about the 3 ways of looking at blood pressure: what's outside the blood vessel, what's in the blood vessel itself, what's inside the blood vessel wall. That these are the ways that you understand the blood pressure as a 3-dimensional thing, as opposed to just high and low. So going back to nitric oxide synthase, and the science is that you're going to make, if you take arginine, you still need those cofactors for you to produce the nitric oxide. And those cofactors are dependent on things like vitamin C, BH4, and then not least you have enzymes all over your body, all over your blood vessels. We call that ENOS because E stands for endothelial nitric oxide synthase. The other 2 are neuronal nitric oxide synthase. So that's why, when you have diabetic neuropathy, it's probably the fact that the oxygen supply has been altered because of the nerve damage as a result of the NOS. So you actually make nitric oxide to support the nerves, and when diabetics that have microvascular problems, they get neuropathy because the blood supply to the nerves die, and therefore you get the numbness, or worse still, the neuropathy in the hands and feet, in the glove and stocking distribution. So there's the endothelial NOS, there is the neuronal NOS. That means that it exists in all the blood vessels in the body. It exists in all the neurons. That means the brain, the nerves. Central means the brain, and the central also means spinal cord. Peripheral nerves means the things that supply the rest of the body from the spinal cord out. And then the final one is the inducible nitric oxide, which is induced when you have an infection or oxidation. And so the reason I'm spending a little bit of time on it, I'm going to simplify it right now, is that your body has the mechanisms for everything. We call it homeostasis. When it needs to release a little bit of nitric oxide because it needs more blood flow, it's going to do that. When it needs to make the inducible nitric oxide, because nitric oxide can actually kill as well, right? And too much inducible nitric oxide, it creates what we call excessive vasodilation. So when people have the septic shock, that means that they have an infection, it's all over their body. We call that sepsis. Shock means when the blood pressure drops. So when you have too much inducible nitric oxide synthase when you're fighting sepsis and infection, that nitric oxide causes such a severe vasodilation that the blood vessels open up so excessively that you have shock. That means your blood pressure drops, and you'll die if you don't have medical attention. And so the point is that you have to understand that there's this dynamic nature to nitric oxide. So yes, we can use our diet as the safest way, really, because the diet has your cofactors. The diet has nutrients that can be absorbed slowly and steadily. Where the danger comes in is when people take too many supplements, that you may make excessive amounts of nitric oxide, but in the wrong setting, it can actually create more of the inducible nitric oxide synthase. It can create more of the reactive nitrogen species, which is a form of like reactive oxygen species, the things that cause pro-oxidation. So when you take too much nitric oxide, you may create pro-oxidation, not by itself, but depending on the environment. If your environment is already in a dysregulated manner, like because it's fighting chronic infection like chronic mono, a leaky gut releases more lipopolysaccharides, which are like toxins from bacteria. When you have autoimmune dysfunction, this is where you have more demand for the inducible nitric oxide synthase that in itself can create more nitrogen oxygen species. So here you are giving yourself, say, arginine, so your body's making the nitric oxide, but they're going to convert that nitric oxide to nitrogen oxygen species, or reactive nitrogen oxygen species, a little bit like ROS. Reactive oxygen species. So too much of those create what we call nitrites. Peroxynitrites, we call it. You have superoxide, that's oxidation. The superoxides become hydrogen peroxide. Both are bad. And then you have too much nitrogen, and nitric oxide, I should say. Too much nitric oxide can create a more the words just get my tongue. Another more nitrogen oxygen species, which are also pro-oxidants, right? So because the body, when it's trying to keep it in the homeostasis, knows exactly how much of the nitrogen oxygen to release. So in the infection situation, when you have toxemia because of lipopolysaccharides from leaky gut, or just chronic infections from chronic Lyme or chronic Epstein-Barr, chronic infection, smoldering infection, maybe say chronic hepatitis B, chronic hepatitis C. These are the chronic infections and other causes of oxidation that stimulate the body to make more of these inducible NOS, more inducible nitric oxide synthase. So just giving unchecked amounts of nutrients that produce nitric oxide may have a deleterious effect. Okay, so again, a little bit heavy on the science, so let's boil it down. Boiling it down is that the body knows how to keep homeostasis. Homeostasis means to keep a body into a state of balance. Now, I know that it's very tempting to find the best holistic doctor that has the best vitamin, the best IV. It doesn't exist. I know it's very tempting for the natural doctor, the traditional doctor, the allopathic doctor to have the best treatment. It doesn't exist. What it is that you have to have the best balance, because homeostasis always wins. Only in exceptional situations, whether it's natural or traditional medicine, we use the prescriptions or we use therapeutic doses of natural for a short period of time. It's like me giving you lots of zinc because it's good for you. Now, if I give you too much zinc, I'm going to drive down your copper. See how excited I get when I talk about medicine. God knows what my nitric oxide levels are right now. So the point is that, in short amounts, we can use it therapeutically, but you cannot use those high doses in the long run, because then you're going to have unintended consequences. And that may be the criticism that you get from the conventional world, is that, how do you know this is safe? And they're correct to some degree. Most of the time, if you have a healthy diet, no one's going to criticize you. Most of the time, if you take reasonable vitamins, they're not going to criticize you, because it's just a nutrient, right? It's just a vitamin. But, for people who are somewhat knowledgeable, but, a little knowledge sometimes can be dangerous. Those are the people, and no disrespect, because I'm one of them. I'm always trying to learn. But if you have some knowledge, it can actually be detrimental, because you start doing things which just sound good. But, for the most part, you'll be okay. But there are going to be situations, because of your genetics, because of toxicity, because of coexisting infections, chronic infections, because of oxidation. The environment is not right, and that gives you unintended consequences. So people who are medical, who want to join in and maybe ask some technical questions, I'll be happy to oblige of the exact processes by which what is good might actually turn out to bite you. And I have perfect experience of that, and I'll go over that hopefully in the next few minutes. So the point is that, giving therapeutic doses of natural or even prescription is designed as a bridge. It's not the treatment forever and ever, namely like Prevacid, Prilosec, Protonic for acid reflux. It's not Actually, it's not FDA approved for more than 6 weeks of treatment. So when you have it for 6 years or 60 years, it's not FDA approved for that, and it has unintended consequences, which now, after 30, 40 years of using it, we know what those are. And people have heard me, we'll talk about it again, or ask me and we can bring that up. So really, even prescription medications are a bridge for a long-term solution. Prescription natural products in large doses, in what we call therapeutic doses, are as a bridge, and then you must have a long-term plan. So the long-term plan definitely has to be the pillars. You don't damage your sleep, don't put the bad food in, put the good food in, then supplement based on your levels. So what are those? So you're having a good balanced diet in your nitrates from green leafy vegetables, having certain foods like beets are very high, not only nitrates, but magnesium and potassium. You've got lots of nitrates in green leafy vegetables, but you can also have nitrates and potassium in, say, coconut, in your edamames, soya beans. You can have it in kale. You can have it in a diverse range of food. Beans are high in magnesium and potassium. So they're very complex. They're complex carbs too. So it's good to have a balanced diet, that you have the nitrates so your body can decide to produce its own nitrites and then subsequently produce nitric oxide. And I don't want to dwell too much on the bacterial flora right now. So diet or your regular food is the best way, because the food comes with cofactors that is very difficult to reproduce unless you go with very reputable vitamin companies, and even they will come short because they can't match Mother Nature. But the nutraceuticals, just like pharmaceuticals, can isolate certain qualities about certain nutrients to get a therapeutic effect. And again, for therapy, not to be using lifelong. It's not like a fish oil that you just take it for lifelong, or vitamin C that you can take it lifelong, or vitamin D in reasonable amounts for lifelong. Those, for now, as far as we know, you could do that, but you can't overdo nitric oxide. You can't overdo, you can't overdo glutathione, by the way. So there are certain things you can overdo, and you have to be very, very careful. All right, I'm going to slow down just a little bit, just to take a breath, and then come back and tell you my story about my own arginine intake. In the meantime, I'm just going to scroll to see if there's any questions. What are these kinds of supplements that can be harmful? Yeah, I'm going to go over that right now. One example. I mean, look, I'm not here to turn people off of it. I just want people to be cautious, because everybody can get on the bandwagon of this is the greatest and the latest of anything. And recently, I'm priming you for the information that's going to come out, because that if Donald Trump has been advised on something, he's got the platform, which is good. Let's discuss it now. Let him have the platform. Let the word get out, and let's have constructive conversation about it. That's all I'm looking for at the end of the day. Okay. So let's give you my personal story. So I was taking arginine because, as you know, arginine can be converted to citrulline, and your body can release nitric oxide. At the time, I also do very sophisticated labs. So I checked for blood tests for inflammation and oxidation and inflammation around the body. I look at enzymes as well. I look at LDL particle sizes, because advanced cardiovascular is a very advanced way of looking at what your body's going through. So I happened to test my blood test for advanced cardiac. I was on arginine supplementation because I was hoping that the arginine will help me produce nitric oxide. So what happened? What happened was that that arginine was ending up converting to nitrogen reactive species. So here I'm using nitric oxide and think it's all good for you. It is, but actually we don't have the latest data. I'm talking about studies in university, so it's not even coming anywhere close to any supplement or anything. But there's a part of the equation that we don't know about. But what it's insinuating is that inducible form of nitric oxide is there to defend us, because it temporarily actually starves the mitochondria of oxygen. So by doing that, what it's trying to do is increasing the liberation, or what we call glycolysis, liberating or metabolizing glucose in the blood vessels. That's the short-term impact of inducible nitric oxide. Inducible nitric oxide does give the vasodilation, but in excessive amounts, that's what leads to toxic shock. What we know about it is that in chronic situations, in chronic disease, you also have these high amounts of inducible nitric oxide, which is not necessarily beneficial. So short-term, even when you're fighting infection, it has benefit. But the long-term nitric oxide is that environment where there's chronic infections or inflammation and oxidation, that's allowing too much of this nitric oxide from the inducible form, which is designed to actually kill. It supports macrophages in killing off bacteria and parasites and viruses, but it can also in chronic state damage your blood vessels by having large amounts that have been found on biopsies and in experimental. So that's not the one we're talking about right now, but it's very, very important to understand that there's another side of nitric oxide that is in the homeostasis. What that means is that how the body naturally deals with it is perfect, but for us to manipulate it can be very dangerous. So with the inducible form, like with septic shock, where they got the infection, the blood vessels opened up initially to get blood flow, but it in fact caused the blood pressure to drop, like in shock. Then they tried to use drugs which actually block this inducible NOS, and they got the result they're looking for, but more mortality happened because you had the unintended consequence of trying to be selectively impacting INOS, and that's the problem. Only the body knows perfectly how to select what it needs to most of the time, right? And then when we try to, we're learning right now, so it's okay to keep learning, but we're going to find through lots of mistakes how to fine-tune that perfect component of the inducible nitric oxide. And right now, you can't just come up with a drug of blocking it during sepsis and hoping for the best. But through that discovery, we will find that out. So the point I was trying to make, going back to what I was saying, is that I don't think mine was necessarily inducible NOS, although I don't know for sure because it's experimental, right? But what I do know is based on my advanced cardiac test, I'm able to measure something in my urine called ADMA, asymmetrical dimethyl arginine. Large amounts are synonymous with low nitric oxide. So in fact, what was happening was that when I took the arginine and I was making nitric oxide, in fact, because of either heavy metals in my body, because of an underlying inflammatory condition, an immune dysregulation, in a chronic infection I'm not aware of, my body was actually making reactive nitrogen species. The reactive nitrogen species actually caused my nitric oxide level to go down, as exemplified by the fact that when I was working out, it was so hard. For weeks, the same cardio seemed so hard to do because of lower nitric oxide level and an elevated ADMA, asymmetrical dimethyl arginine. And the final component, I know it's a little bit over the heads of non-medical people, but the final component is that reactive nitrogen species possibly contributed or was associated with oxidized LDL. And I thought, wow, my light bulb just went off, which is to say that, I've heard about the case where if you use unchecked amounts of arginine, for some people, they don't get nitric oxide. They get some untold consequences. Not only had I heard about it from the people who I studied nitric oxide from, it actually happened to me. So I think I really understand it. I saw my performance go down. I saw my ADMA go up. I saw that my LDL became oxidized. So it was a perfect storm, and I stopped the supplementation at that point. And so sometimes that's a real life story, and you can call it anecdotal if you want, but I'm measuring people's oxidized LDL, I'm measuring people's ADMSA, I'm measuring people's endothelial function at the very least. I'm not actually measuring the nitric oxide by itself, I'm seeing the impact of it on endothelial function, and I use that as a surrogate, although not perfect, pretty good for clinical practice. All right, speaking very, very fast. So if people want to talk about nitric oxide, they can. If they want to talk about the immune system, they can. But nitric oxide is a special molecule that wasn't just designed for bodybuilders, wasn't just designed to lower blood pressure. But if you heard me, that is a phenomenal way to help create a natural way to replenish actually the levels that were supposed to be there. We're not looking for super doses of nitric oxide. We're looking for levels to replenish good levels, physiological levels, to create homeostasis. So let me give you a perfect example of people whose levels are low. People who take anything to lower the acid in the stomach, they have a high risk of having lower nitric oxide levels, because without the acid in the stomach, it's very hard for nitrates to be nitrates and nitrites to then be converted to nitric oxide. That's one reason. And again, when you take the proton pump inhibitors, you're now altering the acid environment in the stomach, so you have a poor bacterial flora, and the poor bacterial flora can't convert nitrates to nitrites. That's another reason why you may not release nitric oxide. So those are the one group of people that you'd have to be a little bit more careful about when it comes to nitric oxide, or lack of, or be suspicious of it. And so and those people tend to also not absorb, those people on proton pump inhibitors who stay on it for year after year after year, they won't absorb minerals as well, so therefore the bone density may be impacted. And what I'm saying is not theoretical, these are actually what's turning out to be fact after 30 years of studying these medication. So the other areas that we can understand that people would have nitric oxide problems are the people with erectile dysfunction. Because now we know that erectile dysfunction is really endothelial dysfunction, very similar to the saying that the nitric oxide levels are going down. So when nitric oxide level goes down, indirectly the cellular cGMP, cyclic GMP, and the cyclic AMP go down. And those then result in lower amounts of prostaglandins, and it results in diminished vasodilation, so you don't get the blood flow in the erection. So the point I'm bringing up is that the people that have erectile dysfunction indirectly have low nitric oxide level. At the very least, they have endothelial dysfunction, which we know is synonymous with low nitric oxide level. That comes before hypertension. So if you're not convinced now, so why do we use Viagra? Viagra is a class of medications called PDE inhibitors, a phosphodiesterase inhibitor, phosphodiesterase 5 inhibitor to be specific. And what it does is that it blocks the breakdown of the cyclic AMP and the cyclic GMP. So it perpetuates the effect of nitric oxide. So really here you have a person with low nitric oxide levels, which results in low cellular cyclic AMP, so they can't get the blood flow in the penis. And then this drug, PDE 5 inhibitors, which is Viagra, Levitra, Cialis, it's supposed to block the enzyme that breaks down the nitric oxide impact. And so really, it's saying the same thing. Now, why do those drugs for Viagra, the Viagra and Levitra and Cialis stop working? Because if you have no nitric oxide to break down, then the medication doesn't work. So those medications eventually stop working because you never ask the question, why do I have erection problems in the first place? How do I know if I have endothelial dysfunction? Not everybody does, by the way. I'm talking about general terms, because some people with erectile dysfunction still make nitric oxide, and some people with no erectile dysfunction still have low levels of nitric oxide. So we're not machines. So you have to have some variation. But I'm talking about generally that the people with erectile dysfunction, not only are they're likely to have high chance of having low nitric oxide, which actually doesn't allow for blood vasodilation and blood flow to the penis, but actually comes long before hypertension. Now, women may not know that as easily, but there probably will be some analogies which I'm not going to talk about right now. So going back to to stay on the hawk on the drug, right? Viagra, Levitra, Cialis, they work. Even in young people, they keep asking for it. Why? Because even young people have low nitric oxide because they have a bad diet. They have bad bacterial flora. They don't have the good acid in their stomach. They don't eat enough nitrate. They don't exercise. Those are the ways to make nitric oxide, right? And not just beetroot and so forth, but that's the diet, right? But the good bacteria will flourish if you have a diverse diet, not just the same old greens all the time. So going back, as I said, why I'm hawking on the erectile dysfunction, because there's a large proportion of population that have it. So 40% of 40-year-old men have erectile dysfunction, 50% of 50-year-old men have erectile dysfunction, up to 60% of 60-year-old males have erectile dysfunction. So it's a real epidemic, in my mind at least. I don't know about pandemic, it's an epidemic. And if that's the case, then instead of just using medication, which is what they all are, and that's why you've got companies like Roman and what's the other one? I'm okay with that, except, I hate those people on the ad. You know why? Especially because the one with the Roman, he starts off like he's an ultimate salesperson, because he lulls you in the sense that he's just a regular guy, just a young guy that had an undiagnosed heart problem. I'd say he had an undiagnosed you don't want to hear what I got to say, but a health problem is the polite way of saying it. And that he just happened to have a father who's a urologist. Really, wow. Urologist knows so much about the cardiovascular system. If they did, then they would alert all their erectile dysfunction to get their heart checked, right? And that's the minimum standard. That's called malpractice at this stage, that erection problems means early heart disease. So if your urologist doesn't give you a referral to somebody other than a urologist, that's called malpractice in my mind. If I was a lawyer, I'd win every single day. That could be my next life, right? Come back to advise lawyers how to get the doctors for not practicing good quality medicine. That'll get them to wake up real fast. Anyway, that's not for today. Today we're going to talk about other things. So the point is that Roman ad that talks about this young kid. Yes, he's got erection problem. Yes, he has a low nitric oxide level. What he does not have is a deficiency of Viagra. And they would like you to believe that they have a doctor on staff, a real doctor. I don't think so. Just a prescription pen pusher, worst type of doctor. Those should lose their license in a heartbeat, because they have a license, but they're not real doctors. A real doctor understands real medicine and helps the patient, not just be a pen pusher. So this company, which is going to be a multi-billion-dollar company, and good luck to them, and hopefully it helps a lot of men save their relationship, but I don't think it will, because it doesn't get to the root of the problem. So let's go back and repeat what I just said. This company called Roman has got this cute little kid that's pretending that he's got an undiagnosed medical problem, and he hasn't even gone to a real doctor, because his dad, he happens to be a urologist, not a real doctor. I'm a real doctor. Internal medicine, primary care, we're real doctors. Hopefully hopefully if we practice well, then we're really a doctor. And he apparently was able to help his son. Why? By giving a prescription of what? Viagra or something like that. And now you can do it on the quiet. You don't have to go to a doctor's appointment. You just go and contact them. They'll give you a prescription because they got a doctor on staff, and you'll get your drugs, and you will have missed the whole disease process and gone on your merry way, only to find, Mr. Roman, that will wait a few years and the drug will stop working because eventually you have no nitric oxide. So no nitric oxide can't be broken down, you can't slow the breakdown of zero because there's nothing left. Right now, when you have low levels of nitric oxide, you can slow down the breakdown with these PD5 inhibitors. But eventually, if you have nothing to break down, then it's a zero from zero, right? It's like you have all-wheel drive and you are now driving on ice. It doesn't matter if you have 16-wheel drive. When you have no traction on the ice, it's zero, right? So you could have half the nitric oxide and you use these drugs, they work. But if you have only 10% or 0% nitric oxide left, then those drugs can't work on anymore. They fail, right? I think I labored the point. You get the drift. So if there's men out there, get seen by a doctor, hopefully a real doctor that understands that the erection is lack of nitric oxide, which is the beginning of endothelial dysfunction, which is the beginning of hypertension, and maybe that little the punk got it half right, that he did have an undiagnosed heart problem. Because if you don't address it for 10, 20 years, you might have heart problems, right? But actually, he didn't have undiagnosed heart problem. He had a low nitric oxide because he probably ate all the wrong crap like hamburgers and pizza. I'm generalizing because I don't know. Now, if Mr. Roman, I call him Mr. Roman out of fondness because that's the company Roman, and the young boy seems to be one of the founders and his father's another founder or somebody at least in the limelight. Feel free to come on live. I'd love to have a conversation with you. Maybe you'd like to hire me on your staff so I can, make your company even greater, right? Like make America greater, I can make your company greater. Just hire me and I'll make what starts as a good intention become the best result because I'll help you fill in the gaps. Take a deep breath. Stimulate my vagus. Stimulate my parasympathetic. And just calm myself down. And then let's see if there's any questions. But this subject is great. It's good stuff. And that's why, it's good to have pharmaceutical products out there. It's good to have information out there so we can talk about it. So look, we did start with the conversation about nitric oxide, and we are still talking about nitric oxide. But as you can tell, we don't have to just talk about, nitric oxide for bodybuilders. We don't just have to talk about nitric oxide and think about the untold consequences. We can think about how nitric oxide is being utilized in day-to-day practice, but it would be better practice if we really understood the three-dimensional approach of everything that we're talking about, right? So if people are joining in for the first time, you may not be aware. So two-dimensional medicine is not really good medicine. Three-dimensional means getting to the root of the problem, and the root generally is never one thing, it's multiple things. So you have to do those multiple things at once. That's why it's multiple dimensions. So I'm calling it three-dimensional. And the same applies to natural. Just assuming that I take this and I'll get that, it works some of the time. And just like a conventional medicine, two-dimensional does have some benefit, but you'll be much better served to understand. I take this vitamin, then I need the cofactors, then I need the right environment, then I get the right result. Think of it as a three-dimensional and multi-step approach. All right, okay, yeah, some comments here. Yeah, I've got some little hecklers. They're my staff. They're just heckling me a little bit. But come on, heckle me with something useful. So no questions so far. So listen, today's Monday. I can be ranting and raving a little bit longer, which I will do. But if you have any final finishing questions, let me know what they are. And certainly I will be hopefully going live probably tomorrow a little bit later, closer to say 1:30. Actually today was pretty late, 1:30, 2 o'clock. So if you want to go live with me or join me tomorrow around 1:30, 2 o'clock. Same with Wednesday, 1:30, 2 o'clock, and same with Thursday. So that's kind of the rough time that I'll be going live. Monday, Tuesday, Wednesday, Thursday. So feel free to join. Think about any questions that you may have in advance, and anything that's in the current affairs on the news, whether it's for COVID, whether it's testing, whether it's about your own immune system, autoimmune disease, whether it's blood pressure, heart disease, osteoporosis, gastric problems, whatever it is. But again, the 5 pillars, let me finish on 5 pillars, which is, don't disrupt your sleep. Don't put the bad foods in, put the good foods in, then supplement. And so that's the key. So the call to action here, I would say, is listen, I'm not against you taking a few vitamins here and there, but as you've heard, whenever I mention the 4 pillars, the 5th pillar is me, coming in to see me and doing the higher level therapeutic ways that I use natural medicine and conventional medicine. But those pillars, the 4th one always ends up by testing, right? Test your vitamin D and then make a recommendation. Test your B12 and make a recommendation. Test your omega-3 and make a recommendation. Test your zinc and make a recommendation. And the list goes on, so I won't go on through the list. But testing is the way to do it. So we can do this as a, in face-to-face. So you come to the office and we can draw your blood. Or we can have the blood draw kits mailed out to you and have a phlebotomist sent out, and they will collect it. And once we go over the test results, we can make recommendations and even send those recommendations out by mail. So we can do face-to-face consultations, face-to-face evaluations, face-to-face physicals, or we can do all the above remotely. And so the call to action is really, if you're taking vitamins, at some point measure them, because you may save a few dollars, because instead of taking too many duplicates and taking things that you may not need, and then you'll be able to focus on what foods you need to concentrate on based on your blood test. You can look at what type of supplements to focus in on. The testing that we do looks at what's in the blood. We call that serum. We also look at what's inside the cells. We call that intracellular. So you can see what's floating around in your blood based on your diet and your supplementation, but after weeks and months, it should enter the cells. So you'll know if what you're taking, the diet that you have and the supplements you're taking, are they actually getting inside your cells after 2 or 3 months, because that's how long it takes to go up and that's how long it takes to go down. So intracellular is a very steady state. And I keep telling you, homeostasis and balance is far more important than large amounts of anything in short amounts of time. The only exception is when you're trying to get some therapeutic benefit for a specific problem. All right, I think there may be some questions here. And so we do home visits too for some people. Oh, somebody's trying to go live. I'm sorry. Let's just go live here for Marlene. So let's see, Marlene, stay on just 1 second. Let me see if I can get that. All right, I'll go live with Marlene. Marlene can go. We're waiting for Marlene to come on live. And so, whatever you want to ask, it could be related to what we just talked about. Hey, Marlene, how are you? Hi, Marlene, can you hear me okay? I can see the background. We're having poor connection, so give her a few more minutes to join in, and let's just see if there's any other questions in the meantime. All right. And so, we're still having connection problems. I know there's a lot of storms going on right now. Whole week is, I think, planned for thunderstorms here on the East Coast, wherever you guys are joining us from. But it's been interesting anyway, we lost it. Sorry about that. But it's been very interesting even with the weather, really. I mean, in this area, we had the wettest July. the hottest July. I think 5 consecutive days of over 90 degrees with some humidity there. So that was tough. And August seems like a really, really wet month. So I'll take the rain any day. I think that's really good for the plants, good for everybody. So we lost Marlene there. If Marlene wants to just answer some questions, or maybe save it for the next time, we could do that. Where do I practice? So I practice out of Bethesda, Maryland. And I also, so somebody else trying to come on. I also practice out of Ashburn, Virginia. So we've got Virgin, Evermander. I mess up names, I'm sorry. So we're going to go live here, waiting for, hopefully she'll clean up the name here on her Instagram. Hello there, how are you? Declined, I missed out again. That's a shame. I love going live. I wish people would go live. I know there are quite a lot of medical people, whether in their residency or not, that join in. So if anybody wants to go live about things, feel free. And it could be about, I said that a lot of things that we talk about are chronic, because that's kind of where we are in this day and age, is chronic disease, unfortunately. But for people who are doing sort of acute care in residency and other clinical rotations, I'm quite happy to talk about acute stuff and then incorporate some of those alternatives, frankly, or some supportive roles, supportive therapies that could accelerate the healing process, frankly. And the acute stuff is always a little tricky for me, because that's when you tend to use more to what we call treatment. And that with natural stuff, we can't treat things with natural stuff, apparently. So that we will find creative words to use. But again, we'll get the point out to people about how to be, holistic and and comprehensive in their diet plan. All right, so look, so later in the week, as I said, I was insinuating I want to talk about whatever this new product is, whether it's great or not good, whether it's experimental, is use it as a topic to talk about what could be useful in making our body stronger, immune system stronger, making our body more resilient. So should we try to prevent the virus from coming in? And should we get the virus in, how do we stop it multiplying? How do we slow down the replication? How do we stop the replication? The faster we can stop the virus from multiplying in our body, the faster we recover, the lower the symptoms, and the less contagious probably as well, right? Makes sense that if your body has a high defense and the virus never gets in, it's not going to replicate in your body, nor can you give it to somebody. Should it get into the body, but you are able to stop it from multiplying, you hardly feel it, or you get over faster, then you'll have fewer viruses to shed to people. So that, stay tuned, because as I said, I just heard that's one thing. And then there are, some traditional doctors. The problem is that I have nothing about ages. I'm getting old too myself. So there are probably some bucks out there in their late 20s, early 30s thinking that they're all that. And that's good. Keep thinking it. It's good to have that sort of energy. But, just because somebody's older doesn't mean they lose their intellectual capability. But what I think they lose is their intellectual curiosity. What happens is that they become entitled to their position that I'm the chairman, I serve for so-and-so. So that means by definition, I know it all. Rude awakening, new stuff are coming so fast in 3 dimensions that you weren't even taught how to assimilate it. And that's the problem, that unfortunately you as an old practicing doctor are still, it's not that you're old, you're practicing old medicine, old thinking. So when you quickly give a no to something that, there's no evidence, because you never entertained, you lost your intellectual curiosity and you didn't contemplate where where it could go. That said, I think that it would be better for you to engage with knowledgeable explanations, and then to use your status of a licensed physician and that experience with that title to say that in these circumstances, this is the best advice. Something like that. Something much more professional than a 100% no. Because you know that if anybody gives a 100% right answer or a 100% wrong answer, and a 100% no or 100% yes, you know that they're wrong, because nothing in life is 100%, right? You know that to be the case. So take that. So alternative to... we're not going to talk about, for chronic pain, we can talk about inflammation at some point, and the underlying things that create more degeneration, like wear and tear, or inflammation, much worse than that, that leads to pain, right? If you have inflammation in your joints and you have arthritis, you're in pain. If you have colitis, you have inflammation, you have pain in your colon. More from Crohn's than ulcerative colitis, but that can still give you a lot of abdominal muscle spasm. If you have inflammation in your tendons or ligaments, then you can have pain as well. So, we can talk about inflammation and chronic pain in terms of inflammation at some point. The other thing, as I said, was the saliva testing. So let's get the information out there. I know there are people who are pretty smart who are listening in. If you want to go ahead and research the best information out there on the saliva testing, I know they were even talking about, measuring urine testing in the sewage system to try to get a sense of the big picture of groups of higher concentration of viral shedding. Fascinating stuff. As I've been saying for a long time, that during this adversity, when all the scientists are working on the same thing, when they're collaborating like never before, because most of the scientists don't want to collaborate with oncology or any field because they feel like somebody will steal their ideas, or they want to be first on the scene. The point is, this is the time when more than ever people are collaborating, they're studying, and they will discover other things in the midst of trying to find treatments and cures and testing for this COVID infection. So stay tuned. That's the silver lining in all of this, is that we will discover things that we didn't plan on. That's how Viagra was discovered. That's how many medications are discovered by accident, because we're researching something, and from the research we discovered something else, right? So that's a fact. That's not just small minority. That's the real deal. In terms of, that's why, for people who are so scientific out there, just look at your research and see that most of the things we do is by association, and most of the discoveries were actually by accident, because you're studying one thing when we found out something else. Anyway, it's not that we're out by accident. It's just keep thinking critically, have intellectual curiosity, never have a quick answer. That's one thing that we were always taught. Never have what we call premature closure. That means that I know that even me and myself, I do it myself. It's human nature that when you've been in practice long enough, you kind of just know the answer. And that may be true for some things, but it's always a good idea to not have premature closure. That means always leave some door open. That what if that lab wasn't exactly right? What if my diagnosis isn't quite right? I've got to be open to it. And what happens that even when I give a quick answer, but in the back of my mind, I know a door is open, because when I see a pattern after the first or second or third encounter and it's not going the way I expect, but that door was always open. I knew that if it didn't go according to plan, I had plan B, or I'd be open to the fact that, it's never that one is going to be always right. But I think I got the right one. And if it goes according to plan, I got it right. If it doesn't go according to plan, that's when I know that I have other doors open to be open-minded and never have what we call premature closure. That means that when you kind of have this fixed belief that you got the right answer, nothing else is the right, then unfortunately even smart people can go off the rails. Anyway, man, can I talk and never stop? Hardly take a breath. It's crazy. It's not good. It's not right. But if people wanted to invite me onto some live environment, like if you're in your education environment, in your work environment, if you can get a large group of people together, I would love to go live. That means physically come travel and present, because I think that the more dynamic is much better. And then, we can then, be dynamic with real life people. Right now, I'm trying to be dynamic with questions which are coming infrequently and lies which we keep dropping, unfortunately. But anyway, it is what it is. So I just keep myself entertained by talking nonstop, right? Hopefully you've learned something. I appreciate you guys joining. I hope you have a great rest of the week and enjoy whatever weather it is and whatever you do, and just keep learning. All right. Thanks for joining. Take care, guys.